Well, joining us now is Dr. Melissa Hirschberg, a medical physician, best-selling author, and founder of U Health Clinic. That's a preventative health and weight loss clinic in Midtown Toronto. So welcome to What She Said.
Thank you. Nice to be here.
Now, you're going to be in for the next few weekends to discuss gut health, natural solutions, healthy eating, and constipation. And this week, we're going to talk about surprising health challenges as we get older, and that is constipation is one of those surprising health challenges. Mm-hmm. So what happens as we get older?
Well, the fact is, as we get older, we tend to get more illnesses and we tend to be on more medications. And that's a big contributor to constipation. So certain prescription medications can definitely cause constipation. Hospital stays also, certain diseases and disorders, travel, and also lack of mobility. So as we get older, sometimes, people get arthritic and they have more pain and it's harder to get out and about. And all those things together mean we see increases in constipation.
So what sort of medications would be the most common that would cause?
So for sure, what comes to mind is painkillers. So, prescription painkillers definitely lead to constipation.
I've got one. When I was pregnant, we used to have to take iron supplements.
Absolutely.
And that was brutal.
Yeah, brutal. Yeah. I actually couldn't even take iron when I was pregnant because of the constipation. Yeah. So, they're in a lot of the prenatal vitamins. Mm-hmm. So also blood pressure medications, certain antidepressants can lead to constipation.
All sorts
There's
of things.
There's a whole host of them, from, like you said, from even vitamins to your prescription medications.
So, a recent survey conducted by Senecot, 46% of Canadians have experienced constipation within the last 12 months, making it a common ailment among all Canadians. But what are the risks of constipation? That nobody wants to talk about it, so nobody wants to find out what the problems are.
So actually, in that same survey, I think they found that, 1 in 10 people with constipation don't even want to leave their house. So constipation, yes, it's uncomfortable, but can also significantly affect how we're feeling and us wanting to get out of the house. Constipation that's prolonged, that's a different story. If you're having constipation that's prolonged or with any, alarm symptoms like weight loss or nausea or vomiting or fever or severe abdominal pains, then obviously you need to go to your physician. Mm-hmm. But what we're talking about here is just the occasional annoying constipation. That's what the 46% of Canadians are saying that they've struggled with in the past year.
What about your metabolism and your hormonal levels? As you go into menopause or teenagers, let's say, again.
Oh, totally. It totally affects your bowels. And if when you talk about pregnancy, with the first few months of pregnancy, from the elevated progesterone levels, a lot of women suffer constipation. So our hormones definitely affect our bowels. And when you mentioned metabolism, so one of the causes of constipation, one of the medical causes of constipation can be hypothyroidism. So when our metabolism slows down from lack of thyroid hormone, one of the symptoms people present to their doctor with can be constipation.
But are some people just born with a different digestive system?
Totally.
My father, some people go every day, and he was maybe twice a week, but he never drank any water.
Okay, so you mentioned it. So there's a few things there.
Yeah,
for sure.
Exactly. But his whole life was the same.
Yeah, so there's definitely a range in what's considered normal. A normal bowel habits can be going once every 3 days to 3 times a day. So you have to figure out what's normal for you. And I think the biggest change is a change from what's normal. If you're used to going twice a day, every day, and now all of a sudden you haven't gone in 2 days, for you, that's severe that's constipation. That's going to feel uncomfortable. Yeah. Absolutely, not drinking water is a risk factor for constipation. So often, this is one of the first things I talk about with patients when they come in, when we're saying, look, I don't know why all of a sudden. Well, we look at diet. Have you been eating enough fiber? Have you changed your diet lately? For instance, have you gone on a diet like a keto diet or a weight loss diet where all of a sudden you've cut certain whole grains out? That might lead to constipation. Are you busy and are you not drinking enough water? Or as we're talking about aging, some people struggle with incontinence. And so purposely they try not to drink water during the day. Well, one of the side effects of that can be constipation. So you have to look at, lifestyle and think about what might be causing it or what you've changed in your lifestyle lately that might be contributing to your constipation.
So Kate has a story, and I want to hear your comment about this story, whether you think this is normal for this person.
So, all his life, a relative of mine has gone once a week on Wednesdays.
Okay.
In his own bathroom.
That in his own, he would prefer to go in his own bathroom, but it became a family joke. Like, oh, it's Wednesday. He must be, what at the time. It is. Yeah,
It's like clockwork.
It was like clockwork, but once a week.
So, like I said, in terms of the normal range of bowel movements, ideally you'd like to see, at least like once every 3 days. So once a week is a little slow, but that can be normal.
Seems fine. Seems healthy.
If that's working for him and that works for his digestive tract, then that's his normal. And we see it with kids a lot too. We get nervous. Oh my gosh, my kid hasn't had a bowel movement in 2 weeks. When you go to the pediatrician, and they'll often tell you, well, that can be normal. Just,
So this my other story is like, this is Senokot. This is I used to make, my grandmother used to have a jar of Senopods in her house, and I used to pour boiling water over them and make Sena tea. But these tablets are certainly easier.
Yeah.
But it's the same thing. It's a completely natural laxative.
Yes. Senokot uses natural senna from the senna plant. What's different about it than some of the other senna products out there is it's using the actual natural senna, whereas a lot of the other products will use just extracts from the senna plant.
And so what is the difference?
So it's just a more natural, less processed senna side, which is actually the laxative property of the senna plant.
So, people hate to take medicine, by and large.
Right.
We only take it when we have to. So is that something you can take on a regular basis and not be concerned?
People prefer to take something over the counter and natural before they're getting a prescription medication. That being said, even with Senokot, something that is natural, it still says for gentle relief of occasional constipation. This isn't something you want to be taking on a daily basis. In fact, if you have constipation that's lasting longer than a week, you definitely need to see your physician and see what else might be going on to cause, a chronic constipation. And to speak to your point about, was it your father or your relative that went once
I'm
a
not
week?
saying who it was.
I think you always need to listen to your body, because if you feel great and you're functioning great going once a week, but if you're going once a week and you feel bloated and you feel gassy and you're having cramps and you're feeling sluggish, well, that means you're constipated. And that's when you might want to look to something over the counter like Senokot to help give you some relief from those symptoms.
So those are symptoms that you should watch out for. So go through them again. You said the bloating.
Okay, so bloating and gas. So people don't sometimes people think I'm bloated, I'm gassy. They don't realize that those are symptoms of constipation. Dry, hard stools, any discomfort or straining when you pass a bowel movement, incomplete bowel movements, or infrequent bowel movements, obviously. Those are all symptoms. And even as a physician, sometimes we forget when someone comes in and says, I just feel bloated. Sometimes I forget to think about constipation, because that can be one of the absolute first symptoms.
See, I always think that it's something to do with my gut health, or I've had a food that's caused a reaction.
Right.
But that is worth
just
noting.
Thinking about constipation.
Should you check with your pharmacist? Are there any contraindications for this?
It's always a good idea to check with your pharmacist when you're taking something new, and especially if you're on other medications. One thing that it does say, when you're taking a medication or like Senokot, don't take it at the same time as your other prescription medication, because it could impair the absorption or the functioning of that medication.
So where can people go to get more information about what you do, and how do they?
Sure. So, if you want more information about constipation in general, you can go online and look at on medical site. You can also go on the Senokot website. There's lots of information there, not only about the drug, but about constipation and gut health in general.
Okay.
And with respect to my practice, you can find me online at melissahirschberg.com.
melissahirschberg.com. Okay.
There you go.
Thank you very much for coming in and explaining some of this. It's fascinating.
Well, she said